Welcome to MedEvidence, where we help you navigate the truth behind medical research with unbiased, evidence-proven facts, powered by Encore Research Group and hosted by cardiologist and top medical researcher, Dr. Michael Koren. Dr. Koren, I heard there is a Lyme disease vaccine being developed for all of us frequent hikers and outdoorsmen. What's your take on that?
Well, thank you for the question. And interesting you bring that up, because to my knowledge, there is no approved Lyme disease vaccine. However, we're working on it. So as we speak, there's some real excitement about this. So just for everybody out there, Lyme disease is a tick-borne illness that was originally discovered in Lyme, Connecticut. So interesting little trivia fact. It was discovered in the 1970s and 80s. And the bacteria that the tick transmits to humans is called Borrelia. And it's actually a Borrelia species that was named after the discoverer of that particular bacteria, named Dr. Burgdorferi. So it's called Borrelia burgdorferi or Borrelia burgdorferi. And this is the bacteria that goes through a tick or an ixodes species that causes the problem. So typically what happens, you're out there hiking, you may not be covered up, you get a tick bite. The tick then will eventually cause a rash to occur, which is the first stage of the illness. Then it can be associated with a fever and sometimes chills. And if you don't discover it, which is very common because sometimes you get tick bites in places that are not obvious, it can get to a second phase or even a third phase. And then it gets very, very tricky to diagnose. And often people have these long-standing inflammatory conditions that elude initial evaluations. And that leads to the need for a long-term treatment approach. So if you catch it early, you can take antibiotics that knock out that bacteria. But if you don't catch it early, which is common, then you're prone to getting this long-term Lyme disease syndrome, which can really be very debilitating. So people who are at high risk for exposure, for example, people who are hikers or people who are outdoors a lot, especially in certain communities that are known to have a lot of deer ticks, for example, we would advise that you keep your eyes and ears open about this clinical research, which will be able to give you a shot so that you're not prone to the devastating consequences of this disease. And if you're in an area where you have access to a center that's actually studying the Lyme disease vaccine, give us a shout. We may be able to get you involved.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.